Today, we're diving into a topic that affects millions worldwide: asthma. It's a condition that can impact your daily life, but with the right knowledge and management, you can live a full and active life. We're here to provide you with that knowledge. Asthma is a common condition that affects both kids, impacting their ability to run, play, and participate fully in childhood activities. It's important to understand how asthma presents in children and how to best support them, and adults. It doesn't discriminate by age and can develop at any point in life. From young professionals to active seniors, asthma can present unique challenges. Asthma is a long-term issue, meaning it's not something that simply goes away. It requires ongoing management and attention, where the airways in your lungs become sensitive and swollen, reacting strongly to triggers that wouldn't bother most people. This sensitivity leads to inflammation and narrowing of the airways, making it harder to breathe. This can manifest as wheezing, coughing, chest tightness, and of course, shortness of breath. Think of your airways like tiny straws. They're the pathways that carry air to and from your lungs. For people with asthma, these straws can get narrower and inflamed, making it difficult for air to pass through freely. This is why inhalers, which deliver medication directly to the airways, are so crucial. This inflammation makes the airways react to things like dust or pollen, pet dander, smoke, or even changes in weather. These triggers can set off an asthma attack. Asthma isn't contagious, so you can't catch it from someone else. And it affects everyone differently, with varying degrees of severity and different triggers. What sets off one person's asthma might not affect another at all. Some have mild symptoms, easily managed with occasional medication, others more severe, requiring daily treatment and careful monitoring. The good news? With the right treatment, developed in consultation with your doctor, most people with asthma can control their symptoms, significantly improving their quality of life, and live active lives, participating in sports, hobbies, and all the activities they enjoy. Modern medicine offers great tools to help manage asthma, from fast-acting inhalers to long-term control medications, so you can do everything you love without being limited by your asthma. It's about finding the right balance and management strategy. In short, asthma means your airways are extra sensitive, reacting to triggers that cause inflammation and narrowing, sometimes making breathing tough, leading to symptoms like wheezing, coughing, and chest tightness. It's a chronic but manageable condition, and with the right approach, you can live a healthy, fulfilling life. In this guide, we'll cover what causes asthma, exploring the various triggers and risk factors associated with the condition, how it feels, describing the range of symptoms and how they can impact your daily life, how it's diagnosed, outlining the tests and procedures used to determine if you have asthma, and how to manage it, providing practical tips and strategies for controlling your symptoms and living well with asthma. Understanding asthma is the first step to taking control of your health and empowering yourself to live a full and active life. Let's get started on this journey to understanding and managing asthma, so you can breathe easier and live better. Asthma can be a scary condition, especially when you don't fully understand what's happening inside your body. So, let's take a look. Let's see what's happening inside the lungs during an asthma attack, or even just when asthma is acting up. We'll explore the specific changes that occur within your airways. Your lungs are a complex and vital organ, designed to efficiently exchange oxygen and carbon dioxide with every breath you take. They're full of branching tubes, airways, that carry air in and out, much like the branches of a tree. These airways, also known as bronchi and bronchioles, get smaller and smaller as they reach deeper into the lung tissue, ensuring that air reaches every corner of your respiratory system. In asthma, however, this efficient system is disrupted. The walls of these airways become inflamed and swollen, much like a bruise on your skin after an injury. This inflammation is a key characteristic of asthma and contributes significantly to the difficulty in breathing. This swelling narrows the passage for air, making it harder for air to flow freely in and out of your lungs. Imagine trying to breathe through a straw. That's similar to what it feels like when your airways are narrowed due to inflammation. But the problems don't stop there. The muscles around the airways can also tighten, a reaction called bronchospasm. This is like a sudden, involuntary contraction of the muscles, further constricting the airways. This tightening makes breathing even harder, creating a feeling of tightness in the chest and shortness of breath. It's like trying to inflate a balloon that's being squeezed in the middle. And if that wasn't enough, on top of that, your body may produce extra sticky mucus that clogs the airways. This mucus is thicker and stickier than normal, making it difficult to clear from your lungs. Imagine a garden hose. If the inside swells, reducing the space for water to flow, the outside is squeezed, further constricting the passage, and it's filled with gunk, blocking the flow even more. Water barely flows, just like air in asthma. The combination of these factors creates a significant obstruction to airflow. These three things, the key components of what makes asthma so challenging: inflammation, the swelling and irritation of the airway walls, muscle tightening, the bronchospasm that constricts the airways, and mucus, the excessive production of thick, sticky secretions, combine to block airflow, making it difficult to get air in and out of your lungs. That's why asthma can make breathing feel difficult or tight. It's a direct result of these changes happening inside your airways. Managing asthma effectively means addressing all three issues: reducing inflammation, relaxing the airway muscles, and clearing the excess mucus. Understanding these changes helps you see why treatment is so important. It empowers you to take control of your condition and work with your doctor to develop the best management plan for you. With the right care, including medication and lifestyle adjustments, you can keep your airways open and breathe easier, allowing you to live a full and active life. Now that we have a clearer picture of what's happening inside the lungs during asthma, let's move on to what triggers these changes and how you can avoid them. What sets off asthma symptoms? Triggers. Triggers are anything that irritates your sensitive airways, causing them to react. Everyone's triggers are different. What bothers one person may not affect another. Common triggers include allergens like pollen, dust mites, mold, and pet dander. Breathing in these allergens can cause your immune system to overreact, leading to airway inflammation. Other triggers are irritants like smoke, strong smells, air pollution, and cold air. Exercise, respiratory infections, and strong emotions can also trigger symptoms. The exact reason someone develops asthma is a mix of genetics and environment. Knowing your personal triggers is key to managing asthma. Next, let's look at how asthma feels. Recognizing asthma symptoms is crucial. The main signs are coughing, wheezing, shortness of breath, and chest tightness. Symptoms can be mild or severe, and they often come and go. Coughing may be worse at night or after exposure to triggers, and sometimes it's the only symptom. Wheezing is a whistling sound when breathing out, caused by air moving through narrowed airways. Not everyone with asthma wheezes, but it's a classic sign. Shortness of breath feels like you can't get enough air, even at rest. Chest tightness can feel like pressure or a band around your chest. Severe symptoms that don't improve with medication may signal an asthma attack. Get help immediately. Knowing these signs helps you act quickly. If you have symptoms like coughing or wheezing, see a doctor. There's no single test for asthma. Diagnosis is based on your symptoms, history, and some tests. Your doctor will ask about when symptoms happen, what triggers them, and your family history. They'll listen to your chest and look for signs of allergies. Sometimes your lungs sound normal if you're not having symptoms, so your story is important. Breathing tests like spirometry measure how much air you can blow out and how fast. If your breathing improves after using a reliever inhaler, it's a clue you have asthma. Accurate diagnosis means you get the right treatment. Let's talk about those treatments next. There's no cure for asthma, but treatments can control it well. Most asthma medicines are inhalers, which deliver medicine straight to your lungs. There are two main types: relievers and preventers. Reliever inhalers, usually blue, work fast to relax airway muscles and ease symptoms. Always keep one with you. Preventer inhalers, often brown, orange, or purple, are used daily to reduce airway inflammation and prevent symptoms. Some people need combination inhalers or tablets for more severe asthma. Using your inhaler correctly is vital. Ask your healthcare provider to show you how. A spacer device can help you get the most from your inhaler. With the right treatment, you can keep asthma under control. Managing asthma effectively isn't something you do alone. It's a collaborative effort. It requires open communication, shared understanding, and a commitment from everyone involved in your care. Think of it as building a strong support system around your health. The cornerstone of asthma management lies in the partnership between you and your dedicated healthcare team. This team typically includes your primary care physician, possibly a pulmonologist or asthma specialist, nurses, and even pharmacists. Each member plays a vital role in ensuring you receive the best possible care. At the heart of your daily asthma management is a personalized asthma action plan. This isn't just a piece of paper. It's your daily guide, a roadmap to help you navigate your asthma and stay in control. This crucial plan is carefully created in collaboration with your doctor, tailored specifically to your individual needs and asthma triggers. It clearly outlines what medicines you need to take, when to take them, and most importantly, what specific steps to take if your asthma symptoms begin to worsen or escalate. To make it easy to understand and follow, the plan uses a simple yet effective color-coded system, much like a traffic light. Green signifies that your asthma is well controlled, meaning you're feeling good and breathing easily. Yellow indicates warning signs, suggesting that your asthma may be starting to flare up and requires attention. And red signals an emergency, meaning you need to take immediate action as outlined in your plan or seek medical help right away. It's essential to share your asthma action plan with your family members, close friends, and teachers, especially if you're a child or teenager. This ensures that they are aware of your condition, understand your triggers, and know how to assist you effectively in case of an asthma episode. Keeping a detailed diary to track your symptoms and potential triggers is a valuable tool in managing your asthma. Regularly using a peak flow meter is another important aspect of daily management, as it allows you to monitor your lung function objectively. A noticeable drop in your peak flow readings can often serve as an early warning sign, alerting you to potential trouble even before you start experiencing noticeable symptoms. If your peak flow readings fall below your personal best, or if you start experiencing any asthma symptoms, it's crucial to promptly follow the specific steps outlined in your asthma action plan. Scheduling and attending regular check-in appointments with your doctor are essential for maintaining optimal asthma control and ensuring that your action plan remains current and effective. Staying organized with your medications, understanding your triggers, and proactively managing your asthma can make a significant difference in your overall well-being and quality of life. By incorporating these daily management strategies into your routine, you can effectively stay ahead of your asthma, minimize symptoms, and live a full and active life. Now that we've covered the essentials of daily asthma management, let's shift our focus to proactive strategies for preventing asthma attacks and minimizing their impact on your life. Preventing asthma attacks starts with knowing and avoiding your triggers. Make your home asthma-friendly. Wash bedding weekly. Use allergen-proof covers and reduce dust and clutter. Keep pets out of your bedroom if they're a trigger, and consider an air purifier. Get your annual flu shot and eat a healthy diet to support your immune system. Exercise is good for you. Just warm up, use your reliever if needed, and choose activities that suit you. Most importantly, take your preventer inhaler every day, even when you feel well. Skipping medication lets inflammation return, raising your risk of attacks. Consistency is your best defense. Asthma doesn't have to hold you back from a full, active life. With the right knowledge and treatment, you can control asthma, not the other way around. Build a strong partnership with your healthcare team and attend regular checkups. Keep your action plan updated and ask questions if you're unsure about anything. Use reliable sources for information and connect with others for support. Remember, knowledge is power. Learn about your asthma and how to manage it. By understanding your triggers, using medicines correctly, and following your plan, you can keep symptoms in check. Asthma is just one part of who you are. It doesn't define you. Take charge, stay positive, and look forward to a healthy future. You've got this.